As we age, health care costs become more and more of a factor. As you know, the cost of health care in the United States is one of the highest in the world. This is something that has to be carefully considered before someone retires. I can't tell you how many times I've met with a couple and they could retire financially except for they're not on Medicare yet. Medicare can't start until age 65. So for many people, purchasing health care for their family and their spouse may be too expensive, so they're forced to work to age 65 to be able to get on Medicare. Unfortunately, the costs don't end there. As we age further, the probability that someone needs long-term care, meaning assisted living, at-home care, or nursing home care, it goes up as we age. 73% of Americans will pay for some form of at-home care, assisted living, or nursing home care. But fewer than 5% of Americans have made any type of plan, purchased any type of insurance, or figured out a way to self-insure against it. This is a gigantic risk. This is a risk that I talk to every client about. We look and see how can we mitigate that risk and make sure that you can thrive in retirement. No one wants to be worried in the back of their mind about, well, what if I spend all my money on health care and my spouse is left with nothing? We don't want you to worry. We want you to plan to thrive in retirement. The key to doing that is to having some type of plan. Fortunately, there's many options today that weren't available 10 or 15 years ago that can help offset the costs of long-term care in retirement. I'd love to talk to you about what those are, to see if they would suit you, to see if they would help you, not to stay up at night and think about how am I possibly going to be able to afford health care and long-term care in retirement. Come in and talk to us and let us help you make a plan.